There are masturbation secrets that could transform the health of men over 60, yet most will never hear them from their doctors. After 3 decades treating older men, I've discovered that what happens in private moments can determine whether you age with vitality or decline. I'm Dr. Grace Miller, and these secrets could change everything. The first and most damaging mistake I see in my practice is what I call the death grip. Many older men have unknowingly conditioned their bodies to respond only to aggressive pressure and rapid stimulation, creating a cycle that destroys natural sensitivity over time. This problem develops so gradually that most men never recognize it's happening. What starts as a harmless habit in younger years becomes a destructive pattern after 60. The rushed mechanical approach that might have worked in their 20s now works against them, requiring increasingly intense stimulation to achieve the same response. Here's what happens medically when you consistently use excessive pressure during self-stimulation. The delicate nerve endings in penile tissue become desensitized through repeated trauma. Blood vessels constrict rather than expand naturally. The smooth muscle tissue that's essential for healthy erections begins to lose its elasticity and responsiveness. Your body literally forgets how to respond to gentle, natural touch. The physical consequences are severe and often permanent if left uncorrected. Men develop what's clinically known as decreased penile sensitivity, requiring harder and faster stimulation just to feel anything. This leads directly to erectile dysfunction during partnered intimacy, as the penis can no longer respond to the softer, varied touch of another person. Many men find themselves unable to climax without their specific aggressive technique. But the emotional damage runs even deeper. I've watched confident men become anxious and withdrawn as they lose the ability to respond naturally during intimate moments. They begin avoiding physical closeness entirely, convinced their bodies have simply given out with age. The shame and frustration create a downward spiral that affects every aspect of their relationships and self-worth. The solution requires patience and retraining, but it's entirely possible at any age. Start by taking a complete break from your current technique for at least 2 weeks. When you resume, use only the lightest possible touch with plenty of lubrication. Focus on the journey rather than the destination, allowing your nerve endings to slowly regain their natural sensitivity. This process can take several months, but the restoration of normal function is worth the investment. But even if you correct your grip technique, there's another common belief that's quietly sabotaging your health in ways you never imagined. Perhaps no myth causes more damage to men's health than the belief that sexual activity should naturally decrease with age. Society has convinced an entire generation that reducing or eliminating masturbation after 60 is not just normal, but expected. This cultural programming is literally killing men's prostates. The research on this topic is unambiguous and startling. A landmark Harvard study following nearly 30,000 men over 18 years found that those who ejaculated 21 or more times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated 4 to 7 times monthly. Yet most men over 60 have reduced their frequency to near zero, believing they're being age-appropriate. When ejaculation frequency drops significantly, the prostate doesn't simply go dormant. This walnut-sized gland continues producing prostatic fluid, but without regular release, that fluid accumulates and stagnates. Think of it like a sink with a slow drain. Eventually, the backup creates problems. The stagnant fluid becomes a breeding ground for inflammation, and chronic inflammation is a known precursor to cellular changes that can lead to cancer. The physical symptoms develop gradually but relentlessly. Men experience increased urinary frequency, especially at night, as the swollen prostate presses against the bladder. The urinary stream becomes weaker and more hesitant. Many develop chronic pelvic pain that they dismiss as normal aging. What they don't realize is that these symptoms are often preventable through regular ejaculation that keeps prostatic fluid moving and fresh. Emotionally, the impact extends far beyond physical discomfort. Sleep disruption from frequent nighttime urination leads to daytime fatigue and irritability. The constant low-level discomfort affects mood and energy levels. Many men become anxious about their urinary symptoms, avoiding social situations or long trips. The fear of developing serious prostate problems creates a persistent background stress that affects overall quality of life. The solution is both simple and evidence-based. Maintain regular ejaculation regardless of your age or relationship status. Aim for ejaculation at least 3 to 4 times per week, whether through self-stimulation or other means. This frequency keeps prostatic fluid flowing, reduces inflammation, and maintains the health of surrounding tissues. There's no expiration date on this biological need. Yet even men who maintain appropriate frequency often carry an emotional burden that's slowly poisoning their bodies in ways they never suspect. The invisible killer affecting millions of older men isn't heart disease or diabetes, it's shame. Deep-rooted guilt about masturbation, often planted in childhood and reinforced over decades, creates a state of chronic psychological stress that's slowly destroying their health from the inside out. Ask yourself this honest question. When you touch yourself, do you feel relaxed and natural, or do you experience a familiar knot of guilt in your stomach? Do you rush through the experience to minimize the wrongness you feel? Most men over 60 carry shame so deeply embedded they don't even recognize it as the source of their declining health. This shame operates like a poison in your system. Every time you experience sexual desire or engage in self-pleasure, your nervous system receives conflicting signals. Your body wants to relax and release tension, but your mind floods you with stress hormones because of internalized messages that this behavior is somehow wrong or inappropriate for your age. This creates a perfect storm of chronic stress that never fully resolves. The physiological impact of shame-based stress is devastating and measurable. Chronic guilt elevates cortisol levels, which directly suppresses immune function and increases inflammation throughout your body. Your blood pressure remains elevated, your sleep becomes fragmented, and your cardiovascular system operates under constant strain. Studies show that men carrying sexual shame have significantly higher rates of heart disease, stroke, and premature death compared to those who've resolved these emotional conflicts. The psychological consequences create an even deeper spiral. Shame breeds isolation as men withdraw from intimate connections, convinced they're somehow broken or perverted. This isolation feeds depression and anxiety, which further elevates stress hormones. Many men report feeling disconnected from their own bodies, as if they're observers rather than participants in their own lives. The constant internal conflict between natural desires and learned shame erodes self-esteem and personal identity. Breaking free from this cycle requires conscious work to reprogram decades of negative conditioning. Start by recognizing that masturbation is a normal, healthy behavior at any age. Challenge the voices in your head that whisper criticism or judgment. Practice self-compassion during intimate moments, treating yourself with the same kindness you'd show a good friend. Consider working with a therapist who specializes in sexual health if the shame feels overwhelming. But shame isn't the only psychological factor destroying men's vitality. There's a hormonal cascade that begins the moment you disconnect from your sexual self. When men abandon their sexual selves, believing it's the mature thing to do, they unknowingly trigger a hormonal death spiral that accelerates every aspect of aging. The testosterone trap is insidious because it feels virtuous. Surely focusing less on sexual matters is what distinguished older gentlemen should do. In reality, this mindset is systematically destroying your masculine vitality. Your body operates on a simple principle: use it or lose it. When sexual activity ceases completely, your brain interprets this as a signal that testosterone is no longer needed. The hypothalamic pituitary gonadal axis, which controls hormone production, begins scaling back testosterone manufacturing. What many men don't realize is that sexual stimulation, including masturbation, provides crucial feedback to this system that you're still sexually active and require adequate hormone levels. The medical literature consistently shows that men who maintain regular sexual activity, whether partnered or solo, have significantly higher testosterone levels than those who become sexually inactive. A study published in the Journal of Sexual Medicine found that testosterone levels can drop by 30–40% within just 6 months of sexual inactivity. This isn't gradual aging, it's accelerated hormonal collapse triggered by behavioral choices. The physical deterioration that follows is swift and merciless. Muscle mass begins disappearing at an alarming rate as testosterone-dependent protein synthesis shuts down. Bone density decreases, increasing fracture risk. Body fat accumulates around the midsection as metabolic rate plummets. Energy levels crash, leaving men feeling perpetually exhausted. Sleep quality deteriorates, creating a vicious cycle of fatigue and further hormonal disruption. Many men suddenly look and feel decades older within a matter of months. The psychological impact strikes at the core of masculine identity. Low testosterone directly affects mood regulation, leading to depression, irritability, and emotional numbness. Cognitive function declines as testosterone receptors in the brain become starved of their primary fuel. Memory problems emerge. Decision-making becomes more difficult. The confident, decisive man you once were begins to fade, replaced by someone who feels uncertain and diminished. Many men describe feeling like they're watching their lives through fog. Reversing this decline requires deliberate action to reactivate your sexual self. Regular masturbation, even without intense arousal, sends powerful signals to your hormone production centers that you're still sexually active. Aim for sexual stimulation 3 to 4 times per week, focusing on the process rather than just the outcome. Engage your imagination and fantasy life, as mental sexual activity also stimulates testosterone production. The key is consistency. Sporadic activity won't provide the sustained hormonal feedback your body needs. While testosterone decline devastates your internal chemistry, there's an equally dangerous process occurring in your vascular system that most men never connect to their sexual habits. Your penis is not just a sexual organ, it's a sophisticated barometer of your cardiovascular health. When men stop having regular erections through masturbation or other means, they're unknowingly strangling one of the most sensitive vascular networks in their body. This circulation crisis extends far beyond sexual function, signaling systemic problems that can affect your heart, brain, and overall longevity. The frequency with which I encounter men who haven't experienced an erection in months or even years is staggering. These men often dismiss this as normal aging, not realizing they've created a medical emergency in slow motion. They've allowed the intricate blood vessel system that creates erections to essentially go dormant, and dormant blood vessels don't just wait patiently to be reactivated, they deteriorate. Penile tissue requires regular oxygenation through erection cycles to maintain its health and elasticity. During an erection, blood flow to the penis increases by up to 30 times normal levels, delivering crucial oxygen and nutrients to smooth muscle cells. Without this regular influx, the tissue begins to develop what's called hypoxia-induced fibrosis, essentially scar tissue that replaces healthy, elastic cells. This process is irreversible once it reaches advanced stages. The vascular damage creates a cascade of physical problems that extend throughout your circulatory system. The same small blood vessels that feed penile tissue are similar to those in your heart and brain. When penile circulation fails, it often signals broader cardiovascular disease. Many men experiencing erectile dysfunction have undiagnosed heart disease, diabetes, or hypertension. The penis essentially serves as an early warning system for your cardiovascular health, but only if you're using it regularly enough to notice changes. Beyond the physical damage lies a profound psychological wound that many men never acknowledge. The loss of erectile function strikes at the core of masculine identity in ways that go far beyond sexual performance. Men report feeling disconnected from their own bodies, as if they've lost a fundamental part of themselves. This psychological castration, as some describe it, leads to withdrawal from intimate relationships, loss of confidence in other areas of life, and a general sense of diminished vitality that affects everything from career performance to social interactions. Preventing and reversing circulation crisis requires commitment to regular erection maintenance, regardless of your sexual activity with partners. Aim for at least one full erection every 48-72 hours through self-stimulation. Focus on achieving complete engorgement and maintaining it for several minutes to ensure adequate tissue oxygenation. If natural erections become difficult, consider discussing erectile aids with your physician. The goal is tissue preservation, not just sexual performance. But even men who maintain their physical function often fall victim to a modern addiction that's rewiring their brains in dangerous ways. The most insidious threat to older men's sexual health isn't physical decline. It's the digital rewiring of their brains through pornography consumption. Men who began viewing pornography decades ago when it consisted of static images now find themselves trapped in a cycle of increasingly intense visual stimulation that's fundamentally altered their neurological response to real intimacy. What troubles me most is how normalized this addiction has become among my older patients. They often mention pornography use casually, as if it's simply another form of entertainment, completely unaware that their brains have been hijacked by artificial hyperstimulation. The pornography available today delivers dopamine hits that are exponentially more intense than what the human brain evolved to process, creating addiction patterns that rival those seen with cocaine or gambling. The neurological mechanism behind porn addiction is ruthlessly efficient. Each viewing session floods the brain with dopamine, creating powerful neural pathways that associate arousal with specific visual cues, rapid scene changes, and extreme imagery. Over time, the brain requires increasingly intense stimulation to achieve the same dopamine response. Meanwhile, the neural pathways that respond to gentle, real-world touch become dormant from disuse. The result is a complete rewiring that makes natural intimacy feel boring or inadequate. The physical consequences manifest as what's clinically termed porn-induced erectile dysfunction. Men find themselves unable to achieve or maintain erections during real intimate encounters, despite having no problem when viewing pornography. Their bodies have literally been trained to respond only to artificial visual stimulation rather than physical touch. Blood flow patterns, arousal triggers, and even orgasmic response become dependent on the specific combination of visual intensity and rapid gratification that only pornography provides. The emotional devastation extends far beyond sexual performance issues. Men report feeling disconnected from their partners during intimate moments, as if they're physically present but mentally absent. Real relationships begin to feel inadequate compared to the fantasy perfection of pornographic imagery. Many develop what psychologists call intimacy anorexia, a complete avoidance of emotional and physical closeness because real connection can't compete with the artificial highs they've become accustomed to experiencing alone. Recovery requires complete abstinence from pornography for a minimum of 90 days to allow neural pathways to reset. During this period, focus on developing arousal through imagination, physical sensation, and emotional connection rather than visual stimulation. The brain possesses remarkable neuroplasticity even in older adults, but rewiring requires consistent effort and patience. Many men benefit from accountability partners or specialized therapy during this recovery process. Yet even those who avoid pornography often fall into another trap that sabotages the very benefits they're seeking from self-stimulation. The speed at which most older men approach masturbation transforms what should be a therapeutic practice into a destructive habit that trains their bodies for sexual dysfunction. This rush-to-finish mentality, often developed over decades of hurried encounters in youth, creates a neurological pattern that makes premature ejaculation almost inevitable during partnered intimacy. The prevalence of this problem among my patients is staggering. Men describe their self-stimulation sessions lasting mere minutes, sometimes even seconds, as they race toward climax with singular focus. They've unknowingly conditioned their nervous systems to associate arousal with immediate ejaculation, creating a hair trigger response that makes prolonged intimacy impossible. What's particularly tragic is that they're also missing out on the profound health benefits that only come from extended arousal periods. When you consistently rush through masturbation, you're essentially training your sympathetic nervous system to maintain a state of urgency and tension. The body never learns to relax into arousal, instead treating every sexual encounter as an emergency that must be resolved quickly. This prevents the activation of the parasympathetic nervous system, which is responsible for the deep relaxation, stress relief, and healing benefits that properly conducted self-stimulation provides. The physical consequences extend far beyond premature ejaculation. Rushed masturbation fails to provide adequate blood flow to penile tissues, missing the cardiovascular benefits of sustained erection. The rapid breathing and muscle tension associated with hurried arousal actually increase stress hormones rather than reducing them. Your prostate doesn't receive the gentle massage effect that comes from prolonged arousal, missing out on the inflammation-reducing benefits that extended sessions provide. Emotionally, speed demon masturbation creates a cycle of frustration and disappointment that affects self-esteem and sexual confidence. Men report feeling out of control during intimate moments, anticipating embarrassing early climax before they've barely begun. This performance anxiety creates a feedback loop where worry about premature ejaculation actually makes it more likely to occur. The shame and frustration spill over into other areas of life, affecting overall confidence and well-being. Retraining your nervous system requires a complete reversal of your current approach. Aim for masturbation sessions lasting 15-20 minutes minimum, focusing on building arousal slowly and backing off before reaching the point of no return. Practice deep breathing and conscious muscle relaxation throughout the process. Use the stop-start technique, bringing yourself close to climax multiple times before allowing release. This trains your nervous system to maintain arousal without urgency, developing the control that translates directly to partnered intimacy. The transformation this creates goes beyond sexual performance. It teaches your entire nervous system how to experience sustained pleasure and deep relaxation, benefits that radiate throughout your entire life and health. The most dangerous mistake an aging man can make is complete sexual withdrawal, the total abandonment of self-touch and sexual connection. This isolation epidemic is silently killing thousands of older men who believe that surrendering their sexuality is the dignified path forward. In reality, they're accelerating their journey toward depression, disease, and death. The statistics surrounding sexual isolation in older men are genuinely alarming. Research shows that men who completely cease sexual activity have mortality rates 50% higher than those who maintain some form of sexual expression. These aren't men dying from sexual excess. They're dying from sexual starvation. Their bodies and minds are literally withering from the absence of one of life's most fundamental biological drives. When a man completely stops touching himself sexually, his body interprets this as preparation for death. Evolutionary biology programmed us to maintain sexual interest as long as we're meant to survive and contribute to the species. Complete sexual withdrawal sends powerful signals to every major body system that reproductive capability is no longer needed, triggering a cascade of aging processes that would normally remain dormant for years or decades longer. The physical deterioration begins with immune system collapse. Sexual activity, including masturbation, stimulates the production of immunoglobulin A, a crucial antibody that protects against illness. Men in complete sexual isolation show dramatically reduced immune function, making them vulnerable to infections, slower wound healing, and increased cancer risk. Their sleep cycles become disrupted as the natural relaxation response from sexual release disappears. Muscle mass decreases rapidly as growth hormone production, typically stimulated by sexual activity, plummets. The emotional consequences are equally devastating and often more immediate. Complete sexual isolation breeds a profound sense of disconnection from one's own body and identity. Many men describe feeling like they're already dead, going through the motions of life without any sense of vitality or purpose. This existential emptiness frequently progresses to clinical depression, as the brain is deprived of the mood-regulating neurochemicals that sexual activity provides. Social withdrawal becomes extreme as men feel they have nothing left to offer in relationships. Breaking free from isolation requires courage to reconnect with your sexual self, regardless of your current life circumstances. Start with simple, non-sexual self-touch. Massage your hands, shoulders, or chest while focusing on physical sensation. Gradually reintroduce sexual touch without pressure for specific outcomes. The goal is rebuilding your relationship with pleasure and physical connection. Consider this a medical prescription for longevity, rather than an indulgence. Yet even men who maintain some sexual activity often approach it with such disconnection that they miss the profound healing potential right at their fingertips. Perhaps the greatest tragedy I witness is men who maintain regular masturbation but approach it with the same mindless efficiency they bring to brushing their teeth. This mechanical, autopilot approach to self-pleasure transforms what could be a profound healing practice into a hollow ritual that provides minimal benefit while missing extraordinary opportunities for emotional restoration and stress relief. The epidemic of mindless masturbation reflects our culture's disconnection from embodied experience. Men describe their self-stimulation sessions as something they do while thinking about work problems, watching television, or mentally reviewing their daily schedules. They treat their bodies like machines requiring periodic maintenance, rather than vessels capable of deep pleasure, healing, and emotional release. This distracted approach eliminates nearly all the therapeutic benefits that conscious self-touch can provide. When masturbation becomes a mindless habit, the nervous system never fully engages the relaxation response that makes this practice so beneficial for health. Mindful sexual touch activates the vagus nerve, triggering a cascade of healing responses, including reduced inflammation, improved heart rate variability, and enhanced immune function. But these benefits require presence and attention, the very qualities that mechanical masturbation lacks. Without conscious engagement, you're essentially going through empty motions that provide temporary physical release, but none of the profound restoration your body craves. The physical consequences of mindless masturbation are subtle but significant. Your body never learns to fully relax into pleasure, maintaining chronic muscle tension even during what should be deeply relaxing moments. Blood pressure remains elevated, stress hormones continue circulating, and the healing cascade of neurochemicals never fully activates. Many men report feeling more agitated after mechanical masturbation rather than relaxed, missing entirely the stress relief potential that conscious practice provides. Emotionally, mindless masturbation perpetuates disconnection from your own body and feelings. Instead of using self-touch as an opportunity to process emotions, release accumulated stress, or simply experience joy, you reinforce patterns of dissociation and numbness. Many men describe feeling empty or unsatisfied after mindless sessions, as if they've eaten a meal without tasting it. This emotional disconnection often extends into other relationships, creating a pattern of going through the motions without truly being present. Transforming masturbation into a mindful practice requires slowing down and bringing full attention to physical sensations, emotions, and breath. Create a peaceful environment free from distractions. Focus on the journey rather than the destination, exploring different types of touch and noticing how your body responds. Breathe deeply and consciously throughout the experience. Allow emotions to surface and be felt rather than pushing them away. This transforms self-pleasure from a mechanical release into a powerful tool for emotional healing and stress management. The final and perhaps most heartbreaking mistake stems from the silence and shame that prevents men from seeking help when sexual problems arise. The most tragic mistake of all is the one that encompasses every other problem we've discussed: the silent suffering that keeps millions of older men trapped in sexual dysfunction, shame, and declining health, when simple self-care techniques could restore their vitality. This conspiracy of silence, built on outdated beliefs about aging and masculinity, is literally killing men who could be thriving. The scope of this silent epidemic is staggering when you consider how many men endure sexual problems in isolation. Studies indicate that over 70% of men over 60 experience some form of sexual dysfunction, yet fewer than 30% ever discuss these issues with healthcare providers or seek solutions. They've been conditioned to believe that sexual problems are an inevitable part of aging that must be endured with stoic acceptance. This resignation to dysfunction represents a massive public health crisis hiding in plain sight. What these suffering men don't understand is that most age-related sexual problems aren't actually caused by aging. They're caused by the accumulated effects of poor sexual self-care practices over decades. The death grip technique, infrequent ejaculation, shame-based stress, testosterone decline, circulation problems, porn addiction, rushing, isolation, and mindless habits all create dysfunction that gets blamed on age. Meanwhile, the simple self-care techniques that could reverse these problems remain unknown because no one talks about them. The physical consequences of this silent suffering extend far beyond sexual dysfunction. Men with untreated sexual problems have significantly higher rates of depression, cardiovascular disease, and premature death. The chronic stress of sexual shame and dysfunction creates inflammatory cascades that accelerate aging throughout the body. Many men develop anxiety disorders, sleep problems, and social withdrawal that compounds their health problems. What began as sexual dysfunction becomes a full-body health crisis that could have been prevented. The emotional toll of silent suffering is perhaps even more devastating than the physical consequences. Men describe feeling broken, defective, and less than human when their sexuality fails. This profound sense of inadequacy affects every aspect of their lives, from relationships to career confidence to basic self-worth. Many men begin preparing for death psychologically, convinced that their diminished sexual function signals the end of their vitality and purpose. The isolation compounds the problem as they withdraw from the very connections that could provide support and healing. Breaking free from silent suffering requires courage to acknowledge that sexual health is as important as any other aspect of wellness. Start by implementing the techniques we've discussed: gentle touch, regular ejaculation, shame reduction, testosterone support, circulation maintenance, porn elimination, mindful practices, and connection restoration. Most importantly, understand that seeking help for sexual problems isn't a sign of weakness, but of wisdom. Your sexuality doesn't have an expiration date, and the techniques that restore sexual function also restore overall vitality, confidence, and joy. You have the power to reclaim what time and silence tried to take away. Your body is still capable of pleasure, healing, and connection. The secrets you've learned here aren't just about masturbation. They're about choosing life, vitality, and dignity at any age. The only question remaining is whether you'll continue suffering in silence or begin the journey back to the vibrant sexual man you were always meant to be.